welcome. Tonight on the show, we're discussing Fiji's COVID-19 vaccine registration and rollout. And we have joining us in studio two guests. The first is Dr. Akeem Ali, the acting World Health Organization representative of the South Pacific. And we also have Mr. Sheldon Yet, who is the UNICEF Pacific representative. Gentlemen, good evening and thank you for joining us.
Good evening. Thanks for having us.
Let's first talk about the role of both of your organizations in the procurement of the vaccine. And we'll go further into discussion about what sort of vaccine we have coming to Fiji and the COVAX initiative. But first of all, what's the role of the World Health Organization and UNICEF in working with our Ministry of Health in securing this vaccine?
Okay, maybe I'll start. Good evening. Thanks for having us. WHO actually work with UNICEF globally and locally to make sure that all the countries around the world that are going to receive the vaccine are ready to receive them when they're ready. WHO specifically looks at the issues around safety. We specifically look at licensing the vaccine to make sure that they become available for emergency use, having reviewed all the data that coming from the manufacturer and the studies that have been done. We also help with policy declaration in terms of who gets the vaccine when and what priority groups to look at, and all the other technical support around monitoring the impact of the vaccine, making sure we can follow up the public health impact for individuals and communities at large.
Yes, and UNICEF, of course, works hand in hand with our friends from the World Health Organization and together with the Ministry of Health to make sure the country is ready to receive the vaccine and to make sure that the vaccine is available. UNICEF procures a vaccine on behalf of COVAX, does negotiations with the company, and then arranges the logistics to get the vaccine from the point of manufacturer to the country in which it's going to be used, in this case, Fiji. So it's a huge logistics undertaking, as you might imagine, and we're doing this all around the world. So it's an enormous undertaking, but it's working very well.
Gentlemen, a two-pronged question for the next discussion that we have. So, first of all, the vaccine that is going to be rolled out to the general public, which one is it? And secondly, why that particular vaccine?
Now, that's a good question. And the question you asked us first, it's probably important to emphasize that we have this global alliance or partnership called COVAX, where UNICEF, WHO, CEPI, Gavi, and other world development partners have come together to procure vaccines from manufacturers. And we know there are several manufacturers working on different vaccines at the moment. We have 3 of them that have now got emergency use license from WHO. And those are now becoming available across the world to be used within that COVAX facility program. So when the COVAX facility started its work, one of its main ambitions is to get a vaccine to everywhere around the world quickly. And therefore, there was a target that we have 20% of the population across all countries around the world to get vaccines at the same time, because then that protects all of us. And with that ambition was set that by the end of 2021, we would have 20% of the population across the globe covered with the vaccines that have now passed the emergency use license. So for that program, Fiji is one of the countries that's benefiting. We have 92 countries that we call the so-called AMC countries. These are advanced market commitment that COVAX has agreed with manufacturers to make sure that those vaccines become available. So Fiji is receiving one of those vaccines that has become available through that system and is receiving the AstraZeneca vaccine.
It really is a product of global solidarity. Yeah. It's a global partnership. It's a recognition that for all corners of the world to be safe, we need to make sure we vaccinate the most vulnerable in every corner of the world. It brings all donors together, contributing money to Central Pot to make sure that people can be vaccinated. It's an amazing success story, actually. And it really is something that is made possible with the work of technical agencies like World Health Organization and UNICEF, large foundations, global foundations, and of course organizations like the European Union, governments like Australia, United States, New Zealand, France, all of them working together.
As you rightly pointed out, you need global cooperation, and COVAX is trying to get the vaccine to as many countries as possible. So from the point that it's procured from the manufacturer, what things do you take into consideration when you consider how many doses each country receives?
Let me start, and I'm sure Sheldon will come in. The starting point is countries are able to express preference for a particular vaccine characteristic, not a brand or a specific named vaccine, but these are the characteristics that we would like the vaccine that we will receive to have. And that's because logistically, you've got vaccines that have to be in ultra cold chain facility, that's very, very cold chain facility beyond what we use for normal vaccine. Vaccines that require 2 doses or 1 dose that are now available. So countries kind of make that expression of preference. And then COVAX will look at the manufacturing pipeline and the supply pipeline, what's available, and all the demands from across the world to make that initial 20% that I was talking about, and then distribute allocated batches to countries. And of course, then also how quickly you can get it into country become extremely important. And this is where our colleagues from UNICEF come in terms of supporting countries to get the vaccine. One other point is that, of course, the readiness for countries to receive the vaccine is critical. And that's not just the logistics element, it's also the population being ready to receive the vaccine, having the right groups already identified and all of that. So part of the work we do with UNICEF, with governments, is to look at what we call risk communication and how we ensure people understand everything about the vaccine in terms of safety, how it's going to be used, what the advantage is for individuals and for the public. I don't know, Sheldon, you want to add?
I mean, I think sometimes people get lost in, is it vaccine A or vaccine B or vaccine C? The important thing to remember is that all these vaccines are very safe and very effective. They've been used now across the world. Millions of people have received them, and we know they work. We know that they're essential, combined with the public health measures that are already in place, in keeping the world safe and bringing an end to this global pandemic.
So we'll go to a short break. When we come back, we'll talk more about the efficacy of the AstraZeneca vaccine that we've had in the first phase of rollout in Fiji. So stay with us for that. We'll be back after a short break. Welcome back to the show. We're discussing Fiji's COVID-19 vaccine registration and rollout. And now joining us on the show is Dr. James Fong, Permanent Secretary for Ministry of Health and Medical Services. Dr. Fong, welcome to the show. Thank you for joining us. Let's talk about, since we have you here, what's the current COVID-19 situation in Fiji? And talk to us about how the rollout has been so far in terms of numbers.
Good. So currently, we've had 67 cases that have registered in Fiji within our borders. Obviously, since the last case outside the border, our border quarantine case is about 340, what we say 340 days since our last community-based diagnosis of a case. Otherwise, since then, over the last 340 days, we've been just diagnosing cases that are within quarantine border. It's about something like 40 or almost 50 cases that have been diagnosed within our quarantine border. One of the other metrics that we have done quite well with is with regards to the total tests that have been done. We have done about 35, almost 36,000 tests. We have current rolling average, it comes out to about like 40 tests per thousand, or 40 tests per thousand population, which measures up quite well when you look at the world data. We've had a test positivity rate of 0.2. So usually less than 5% is considered good. So 0.2 makes it even better. And if you switch it around, that means for every positive case that we've had, we've had 493 cases that were negative. So all those parameters do say we are COVID contained. However, there are other effects of the containment which we all understand quite well, and that is the socio-economic impact, the impact of border closures, and this needs to be mitigated. In recognition of that, everybody knew that we had to, at one point, bring in vaccines to facilitate more opening of borders. And however, I think so we brought in the first lot of vaccines. There was sufficient vaccines for 6,000 persons to be vaccinated twice. It turned out that when it arrived, the vaccine packs had some extra buffer doses in it.
Right.
So to date, we were able to get up to just a little bit more than 6,250 persons getting the first dose. And we've marked them up. They all got a date for their second doses.
And as was previously said by the ministry, these are frontline workers?
Yes, they all frontline workers in the sense that they are people who have high exposure to travelers, or high level of exposure to travelers.
Dr. Akeem, if I may, looking at what you said in the previous segment about making sure that 20% of the population is first covered with the vaccines, how close is that with the current status of vaccine rollouts in Fiji?
Fiji is making good progress. The allocations are coming in allotments. And initially in the Pacific, it's to cover as many people as possible. So that promise of 20% is up until the end of the year. So everybody's got a fair bit of that initial allocation, and so Fiji's got an initial allotment, and there are further batches expected soon. The dates are not certain exactly yet, but that will be in the very near future.
So the ideal situation here is for us to get enough vaccination rates for us to be able to confidently open our borders back up. Dr. Fong, what are those numbers looking like? So what's your target goal to reach before we're confident enough to open our borders back up?
If just in probably a more theoretical sense, if we can ensure that those who are vulnerable to severe disease, hospitalization and death have been covered, then that's the group that is targeted. They are within the 20%.
Okay.
And that is the big group that is covered. Of course, we do need to make sure that there is good coverage within that group. And they already, we know that we're registering them directly from our special outpatient clinics, from the hospital data that we have. And there will be ongoing engagement of our general practitioners to make sure that we can get more and more of these, of those with morbidities. Ideally, we want those with morbidities and those over the age of 60 to have been covered, and that gives us some moving room. Having said that, I must say that there is also another part to this. We've got to make sure that we strengthen our community surveillance and our containment program. The community surveillance and containment program has been running. That's what I mean by when I mentioned all those tests, that we are testing quite widely within the community. But ensuring that we maintain that impetus of testing quite widely, it does require some navigation, so that when you have, say, for example, if we increase the number of people moving into one particular area, we need to have community surveillance boosted around that area.
Yes.
And our containment regime needs to be boosted around that area. And so on and so forth. It's like as you increase the amount of travel into various areas, you do need to have a parameter around it where you have boosted levels of surveillance and containment.
I don't mean to sound pedantic, but looking at the vaccine itself, there may be some general misinformation or there may be some confusion, because it is quite problematic for the ordinary Fijian to be able to understand why we have the vaccine and why a certain type is coming in. If I may just digress, looking into the vaccine itself, if you could tell us why this particular vaccine has come to us. Does it make a difference in the type of vaccine? Why AstraZeneca? And there's been word about the efficacy and the effectiveness of vaccines. Dr. Hakim.
Oh, thank you, Geraldine. Efficacy of the vaccine is an important term. And what that means is that in optimal condition with healthy people, in a controlled clinical trial, we determine that the vaccine does what we want it to do, which is to protect people from severe illness, to protect people from dying from the disease, and also to control the transmission if we could. So all the vaccines that are currently available are all effective at doing that in that, study trials that have been conducted. With that, we are confident that if we provide the vaccine to various populations, it should protect from hospitalization, as Dr. Fong has just said, from severe illness, and also ultimately death. So whichever vaccine is received actually will do that. So that's first good news. Then there is all the determination about what is the easiest vaccine to use based on all the logistics that I was talking about earlier on in terms of cold chain, getting them from point A to point B, how many doses are required. Luckily, we have the COVAX facility with those 3 vaccines that are available through them actually being available to countries. So Fiji's got the AstraZeneca one because it's produced, it's available, the supply is there, so, and it's an effective one. It comes down to.
So we'll throw that question because this is something that's really important, really central to our show tonight, is that people adequately understand why we are having vaccines in the first place, because it may seem like a silly question in the first place, but we'd like to throw that question to Dr. Fong and also get your thoughts, Sheldon, on that when we come back from our break. So stay with us. We'll carry on the discussion after a very short break. Welcome back to the show. So we're discussing the efficacy of the vaccine. The one that we have in Fiji is the AstraZeneca vaccine. Dr. Hakim, in your explanation, you told us that efficacy is something that is determined during clinical trials, and it does not it's not necessarily the best way to determine what a good vaccine is and what a bad vaccine is, right? It's not something that we should use or rely on to judge the effectiveness of these vaccines. So what's the difference between a vaccine like AstraZeneca that has 67% efficacy and something like Moderna or the Pfizer vaccine that has a 95% efficacy rate?
I think my starting point is to clarify that you can't compare the vaccines because those trials, what they do is they set an endpoint that they want to measure, and each trial measured different endpoints for the efficacy results. Overall, the objective is let's reduce death, let's reduce severity, let's reduce hospitalization. But there are various points that those are measured. So that's why you get varying figures to start with. But more importantly, and I'm sure Dr. Fong would want to talk about this, the vaccine, when it gets into the community, it has to protect as many people as possible. So it depends on the number of people that you actually vaccinate that leads to the real world effectiveness, which is exactly what Dr. Fong is trying to explain in how you get into the communities in and around Fiji.
Dr. Fong.
Yes, I think it's important to establish the fact that our biggest priority is really reducing hospitalization, severe disease, death. Anything after that is a bonus. Now, when we talk about efficacy, sometimes what they've done is that they've included what's the possibility of transmission and having mild disease, transmission and being asymptomatic, and certain other endpoints. So when you do that, then the numbers start to change. But when you just rely on the top 3, hospitalization, severe disease, and death, they are stable. The protection rate is more than 95%. In fact, for AstraZeneca, the last US data said 100%. And as we said, when you saw the efficacy data, initially they said 67%, and Australia and New Zealand, if you see the American trial, it went up to 79% or 76%, was it?
Yeah. So if we try and sort of quantify this, so on one end of the spectrum you have the ideal outcome, which is no infection at all once you've gotten the vaccine. On the other extreme is death, right? In between, you've got hospitalization, you've got severe symptoms, and then towards the other side, you've got lighter symptoms, a mild cough. So you're saying any of these vaccines will protect you from the more severe symptoms like hospitalization or extreme or death, but they will not necessarily give you zero infections.
Yes.
I think it's really important to remember that all these vaccines are excellent vaccines. They're all safe, they're all effective, and they're very, very appropriate for use here and use in every country in the world. We know they work. The evidence is clear. The science backs them up. And they are an essential tool, but not the only tool, to keeping the population in Fiji safe.
Gentlemen, if we could look at the prioritized groups, those that will be given first priority for the vaccines for the general public, could you tell us who those people are and why that particular section of the population?
Right. I mean, WHO's recommendation is that we start with health workers who are right in the front line treating patients who are likely to receive patients, and then the elderly who, are at higher risk, and then we continue from there to people with comorbidities and all of that. And Fiji is doing well in looking at priority group based on exposure to the potential source of COVID-19 illness in Fiji, which are travelers coming in, as we have no community transmission. So Dr. Fonga and team have been working on that, and you probably would want to highlight, the process and the figures so far.
So for us, we've got a local nuance to our deployment plan. We know that if we had community transmission, we would have gone first we would have decided that, okay, the people most in need will be the vulnerables, those who are vulnerable, the hospital workers, they'll be considered the ones in front. In this case, in Fiji, all our cases are at the border. The people who are most likely to get exposed are therefore the priority group. Then we say, okay, we are looking at some degree of economic recovery, we need to have some border opening. So the next group will have to be those with significant mobility and over the age of 60. So this is our slight nuance to the recommendations that have come in. We've just made sure that we said, okay, let's make sure that our deployment plan is relevant to our context.
So for the people that have already been given the jab, there's been a lot of talk about some of those people getting or developing symptoms. Would you like to discuss that?
Is out of the 6,000 that we've got, or 6,000 plus, 6,250 plus, we've had some with side effects, but nobody has had an adverse reaction. We have made sure that at the places that we do the injection, there is a group of people that will watch for adverse reaction, not because we say it's going to happen, but because it's a reassuring. It's evidence that we are prepared to mitigate against that possibility. When you look at all the other general reports about adverse reaction, the biggest problem about adverse reaction is trying to say, is it caused by the vaccine? So one of the things that we have done also with the medical group is to make sure that anybody who's coming for injection doesn't get an evolving problem. Say, for example, if you're having some chest pains, we might say, okay, no, let's not give it. The reason being that if you have the heart attack immediately after it, and then everybody will say it's because of the vaccine. But we're mitigating that risk by ensuring that we take a good history from you first to make sure there's no evolving issue, and then we give you the vaccine. It's not because we think that the vaccine is dangerous for you, it's only because we don't want it to look like something bad happened after the vaccine.
Okay, so we'll carry on the discussion, and I'd like to ask our WHO and UNICEF reps about the global response to some of these vaccines and why in some countries they've expressed a particular preference, why in some countries they've stopped the rollout of a particular vaccine. So we'll discuss that when we come back from our break. Stay with us. Welcome back to the show. This next question is to all three of you gentlemen. There are some countries, especially European countries, that stopped the rollout of the AstraZeneca vaccine because of the symptoms that some of their patients developed. Why do these patients develop these symptoms? What does it mean? And why have some countries stopped the rollout of AstraZeneca vaccine?
I think it's important to remind viewers that some countries temporarily stopped, but almost all countries have resumed vaccination. And they've resumed it because, again, the evidence and the science speaks for itself. There is no evidence that the vaccine has caused any of these issues. With any, as Dr. Fong was explaining, there's always the issue of correlation and causation. You know, what causes what? Again, sometimes adverse reactions happen, but they have nothing to do with the vaccine itself. And I think that has become abundantly clear to the watchdogs, those people who are responsible for that. That's why countries have largely resumed vaccination.
Gentlemen, if I may, just to clear this, because there may be people out there who might think, okay, so you know, the general consensus that they might have is if I get injected with something, it's supposed to cure me. I should not have any symptoms whatsoever. However, a vaccine works differently. So just for clarity's sake, if you could
someone
let
who
the viewers
doesn't know the biology
what is
behind
what
it,
is
yeah.
a vaccine and why will it present at least some sort of symptoms?
Right. So with vaccination, most products we've used for vaccination, there have been mild side effects that people experience, a bit of fever, a bit of pain on the sides, a bit of swelling. Occasionally you have allergic reactions that are either to part of the constituents of the vaccine, which is why when we do vaccination programs, we monitor all of that very closely. We make sure that in the clinical setting where a vaccine is given, there is an observation before people go away. And also, and particularly for this COVID-19 vaccine, we do that monitoring across the world. Because what we are also trying to find out is any rare side effect. So, you know, if you have one case in one country, that seems rare. But when you then see one across all the different bits of the world, then you can see whether actually this is, you know, potentially associated with the vaccine or not. Having seen that, you also then need to look at, exactly as Sheldon was saying, the causality. Actually, is it plausible that this thing was based on having got the vaccine or something that was going to happen anyway? So particularly with the AstraZeneca vaccine, the recent reports about blood clots, that's why it was important that it was investigated properly. And we look at the cases, look at who actually reported the illness, what happened, and with all the data that's available, it was concluded that it's unlikely that it was caused by the vaccine. Nonetheless, we keep a watchful vigilance to make sure that we can follow up for the short, medium, and long term about the vaccine.
Dr. Fong, would you like to?
Yes, I think the part about the side effects, is one of the things the vaccine always does is that it causes the body to start manufacturing new soldiers. We call them, you know, soldier cells, you know, cells that help to boost your immunity. And in some people who have never been exposed to many antibodies, they will develop fever and chills and fit of cold. A person like me who's lived long enough to be exposed to so many other pathogens in my lifetime, I didn't feel anything. And that's expected. It's expected in terms of the body and how it varies and how it reacts to when it makes new things in your body. But it is part of your body. Your body made that soldier. It's not a soldier that we introduced into your body. We gave the body the ability to make the soldier.
So in essence, it is not something that is introduced into the body. Your response to the vaccine is your own body. It's got nothing to do with the vaccine causing something in you. Is that what you're trying to say?
Well, what I'm saying is that your body is reacting to the vaccine in order to make you stronger and be able to resist any bad effects of COVID-19. In the course of making you stronger, you will have some side effects because of the amount of adjustment that it is doing.
Right.
But that's not a disease in itself. that is actually protecting you from something worse.
Yeah.
So experiencing mild symptoms shouldn't be a reason for you to be scared of receiving the vaccine, right?
Yes.
Shows the
That's
immune system is working.
In
Yeah.
fact, that's an important point. For the vaccine, the benefit of it is a lot higher than the mild symptom that you might experience. And that is one thing that we want the public to be very conscious and aware of. As Dr. Fung said, your body is stimulated to get ready if ever you were to be exposed to COVID-19 to actually be able to stop the infection from rampaging through your body.
If I could pose a hypothetical situation, Dr. Fong, you're the only one of us right now who has been vaccinated for, of course, reasons that we're all aware of. If someone were to wonder, well, why should one get vaccinated? What does that mean for someone who is vaccinated as opposed to those who are not vaccinated in the instance of a community transmission or a breakout?
okay. As I mentioned, there is a bigger picture that we need to look at. We can't Fiji cannot survive if we keep closing borders. If we keep closing borders, the poor people will get more poor. People will start to get desperate. Chaos will result. At some point, we need to have a means to engage with the rest of the world. One of the weapons is the vaccination. Apart from that, we have heightened our community surveillance, we've heightened our ability to contain, but the community surveillance and the ability to contain is not enough. We need the vaccination to supplement those other ones. So that's the reason why we need people to engage. And it's critical that everybody engages. Okay, I also need to be very clear, we do not envision making it mandatory for anybody. We don't at all envision that. All we are saying is that in order for us to engage with the external world, you need to be protected. It may mean that if you do not wish to be vaccinated, fine, that's your choice. It just may mean that you may not be able to move into spaces that engage in the rest of the world. And that is a choice that you will make. Everybody will respect your choice. Nobody will ever coerce you into doing anything that you don't want to do. It's just that your choices will be limited, and we can't do anything because we can't put unprotected people in dangerous places.
So just one question before we go to another break. When will the next dose of COVID-19 vaccines arrive in the country, and will it be AstraZeneca vaccines?
Maybe I can answer that one. There is incredible demand all around the world for this vaccine. There's demand because we know it works. We know it's safe. And because of that, the manufacturer, AstraZeneca, is ramping up production as quickly as possible. We expect the next tranche of the vaccine to be coming here sometime in the next 3 weeks or so, but we can't give the exact date because there are a lot of unknowns still in the process here. But we do know that the supply has been secured for the country, and we know that it's coming. There's some 88,000 doses that will be coming here by, I would guess, by the end of May at the latest. So more supplies are coming, and we're looking forward to their arrival.
So we'll carry on the discussion after a short break. Stay with us.
Welcome back. Dr. Fong, if you could look at something that's been in the media and, of course, on people's minds recently. It's about the vaccination for the COVID-19 vaccine. Now, first of all, those that register, are they guaranteed a vaccine, or does that put them on a higher priority list to get vaccinated?
Yes, it's an interesting question. This particular vaccination program is different from previous vaccination program in that we now require you to register. The reason we require you to register is that part of the discussion about engaging in the external world is to be able to validate the fact that you are protected through vaccine. Apart from the other measures that protect us, protection through vaccine needs to be seen by the countries that we engage in travel with. So for that reason, we're asking people, please register. Once you register, we will only vaccinate from within the registered group. We have to do that because, as I said, it is part of the way that we engage with the rest of the world. The registration process requires your birth registration number if you are born in Fiji. It requires a citizen certification number if you're naturalized. And we are exploring other numbers that may be unique and cater for some people who do not have a birth registration number, nor do they have a CCN. But that's part of an evolving process, because we know that most people will have the birth registration number and the CCN. There is a small group that doesn't have it, but they will be caught. We will get them into the registration process.
So currently registration is being done online via the Digital Fiji app, if I'm
Yes.
not wrong. But is there an offline mechanism for those that may not be able to access it online?
Yes, we have actually got close to almost 200 tablets that have been distributed and deployed through various teams that will go out. Some of the function of these teams you would have seen during the TC Yasa and TC ANA, where people go out into the community and do some work. And in response to some disaster, we have positioned ourselves as a ministry to be able to respond to any community-wide response that we may need. And registration is a community-wide response. Teams will move out. They will be face-to-face registration that does not require online.
So, as we approach the end of the show, let's just take things to a more, I guess, a global public health perspective. Dr. Ali, we know that, as a global community, the ideal outcome for us is to completely eradicate COVID-19, to get everyone's borders open back up. And for that, you don't need 100% of every country to get vaccinated, right? And also after that, Mr. Yet, especially on a local level, we still need to maintain the current, COVID protocols that we have in place, right? So, from the WHO perspective, what's the ideal outcome for you?
The ideal would be that as many parts of the world as possible is protected. It's a global effort. No one country can do it on its own. And therefore, all the public health efforts that are being put in place, both in terms of vaccination, advice about social distancing and all of that, goes on in all the countries. Monitoring information about transmission, about disease, about variants in various parts of the world is a collective global effort, so we can follow up, we can monitor, and we can respond accordingly based on the best public health measures possible.
Yeah, I think we have to take our hats off to the fantastic work done by Fiji's frontline health workers and the public as a whole in keeping this country free of community transmission of COVID. And one of the reasons why it is free is that good hygiene practices are being maintained. Good social distancing is in place. And it's important that we maintain those, that we keep them. Yes, we need to focus on the vaccine, but we also have to look at it in the broader package of items that are necessary to put an end to this global pandemic.
So just as a final question, because I'm sure there's quite a lot of wagging tongues out there that would come up with conspiracy theories, to put those tongues to rest, who's paying for the vaccines?
The vaccines currently arriving in Fiji come from the COVAX facility, which is a global partnership effort that is funded by partners from EU, United States, New Zealand, and with UNICEF, WHO, CEPI, and Gavi working together. So it's a global effort.
So
donations.
We've managed to discuss a lot of issues regarding the vaccine registration and rollout. So we'll just go around the table and just get one final thought in from each of you gentlemen. So if you're trying to reach out to any one of our viewers watching out there, what message is it most important for them to understand about the vaccination process?
For me, it's that it's safe, it's effective, and it would help you combat any threat from COVID. So take the advice from the Ministry of Health when you're given. And when you're invited, please do attend and get the vaccine.
Dr. Fong.
Yes, I think the biggest advice I'd give to everybody is, look, we in this together. And we need to be thinking of each other. Economic engagement is important for all of us. We cannot leave any part of Fijians out of that engagement. And so, engaging in vaccination, registration, vaccination, is part of a broader view that the Ministry of Health has to alleviate or to reduce the risk of poverty. Poverty is a public health response that we feel very close to. And so I would appeal to people, please, don't think of this as something that's only with me. Your decision affects a broader group within the community.
That's exactly right. Follow the advice of the Ministry of Health, follow the advice of the World Health Organization, of UNICEF, and you owe it to your sisters, your mothers, your fathers, and community members. Follow that advice, get vaccinated, maintain the good practices that have already been kept this country safe.
Dr. Ali, Dr. Fong, Mr. Yet, thank you very much for taking your time out. Some very important things discussed, and hopefully I'm sure that this has been of benefit to our viewers as well. Thank you very much for your time.
Thank you.
Thank you.
Thank you.
And that's all we have for you on the show tonight. Have a good evening.